X stands for diagnostic products. And I think the medical devices and the instruments are pretty good candidates to be manufactured in this area. Biopharmaceuticals, again, the highest paying, is the next, and then academic research. In San Diego, as an example, we have UCSD, University of California, San Diego, an excellent research institution, academic school. We also have the Salk Institute, Scripps Institute of Research, and the Sanford Burnham Institute. Terrific. And all of these companies are doing research that may end in a product that shows promise for healing a disease. And then because the university is not, or the institute is not in the business of selling, manufacturing and selling products, somebody will come in and license it. Then that person has to go raise some money, get the right people, and go through the perilous process of trying to turn that discovery into a product that's approvable by the FDA and has clinical utility. It's able to do something better than other products on the market. Those are the keys, and that's why it's such a risky proposition. The Cali-Baja mega region. Ingredients for a successful bioscience cluster. We've talked about that. Academic and institutional research centers, an entrepreneurial culture, people willing to take a risk, people that like excitement, people who are willing to take a second or even a third mortgage on their house to raise the money to license a product and to keep it going. One of the reasons I think that China is so interesting is because those people are like that. They really want to have their own business, and they're willing to put almost everything on the line in order to try to accomplish that. A supportive economic policy, have to be supportive. There has to be people who value the jobs you're creating and the intellectual capital that comes along with those jobs. So you get some tax incentives. They sell you land at a low price. They give you some low interest loans to get you started. All of that is really important in a company deciding to locate here or there. Access to venture capital or other sources of funding. In China, it's all government funding. In China, the government will give loans that will be forgiven after a period of time. That's very rare in California. California is a hostile place for business, which makes this area look particularly good. And you need a skilled, cost-effective workforce, and that's hard. That's difficult in the beginning. When you're the first company, you'll have to hire people in from the outside, people who know how to do this from other parts of the country, and that's expensive. So it's very difficult in San Diego to do that because the cost of living in San Diego is high, relatively speaking. So most of the interviewing and recruiting we do in San Diego is in January and February. And we target places like Boston and New York, where it's snowing, it's cold, everybody has a cold, to come to San Diego and see how nice it is. And of course, that works here too. And experience management, that comes over time. And a lot of times you won't find people in big pharma companies who are willing to take a well-paying, safe, comfortable life and put it on the line in a risky biotech venture. Some do, and they're the entrepreneurs, most will not. And I guess the other ingredients of a successful bioscience cluster, and I didn't put that in there, the fellow who typed it did, an average annual temperature between 65 and 70 degrees Fahrenheit. Can't hurt. Cali-Baja, the mega region, has these ingredients. And this area includes San Diego, Imperial counties, and Baja California, Mexico. And there is a public-private partnership founded in 2008 by the San Diego and Imperial Valley Regional Economic Development Corporations, and we have $225,000 to spend. There are many people north of the border who are really committed to see this area grow and prosper, more than it has, because the potential is enormous. And you have so much that's complementary to the other side of the border in San Diego. Malin Burnham is a close friend of mine and is convinced that we're going to have a cross-border Olympics soon. He's talking about an airport on the border that both people can use. And when we had lunch last week with your esteemed president, proposed the idea of making one country out of three, taking Canada, the United States of America, the United States of Mexico, and doing away with all borders. Why not? That's what Europe did. Remember, the European Common Market started with 6 countries in the beginning, and look what it's grown to. I think we can do that. Not going to be easy, but if we plant the seed now, and Malin has spent a lot of time in Washington trying to plant that seed, we'll get it done. And this is some of the reason. Great access to consumer markets, physical communications, train, bus, truck, airplane, intellectual and scientific financial resources, 50 research institutes, 6 top-rated universities in the area, and 40 venture capital firms, ample infrastructure, business incentives, room for major expansion, and an experienced, skilled, low-cost workforce, and temperatures between 65 and 70 degrees. Now, I know the mega region is focusing in 4 areas: clean tech, and that's alternative energy generation, such as geothermal and solar. And I suggest that maybe look at algae too. That's a renewable resource. I think it's fairly clean. And the area, the sunlight, the water, and the CO2, the carbon dioxide, all here. And the guy who's starting it all is 25, 30 miles away, Craig Venter in San Diego. Logistics, perfect. Specialized manufacturing, and that would be assembly, computer electronics and televisions, and then applied biotech. You already have a good start there in devices, diagnostics, and research projects. And that's the area I'm focused in on. Leading bioscience companies in the mega region. Life Technologies, Life Science, they have products. They probably have 35, 40,000 products. Small things that they sell to universities and pharmaceutical companies to use in research. GenPro, which you'll hear more about in a couple minutes. ResMed, run by a close friend of mine, for sleep disorders, sleep apnea. He's a guy who was working for Baxter, and Baxter was going to sell this little division they had for sleep disorders. And he looked at the price, and then he looked at the potential market and said, I'm going to buy it. And he mortgaged his house and bought the company, and right now it's probably got a market cap of $3.5 billion, maybe more. Done extremely well. Illumina, neat company, right across the street from GenPro practically, and they have sequencing. Sequencing is really important. It's used in research to try to find new drugs and new chemicals. Amylin, I think, is insulin. Medtronic is down here. Medtronic's a terrific company. I think they had the first pacemaker for controlling dysrhythmias of the heart. And they have a lot of other devices. Great back, same sort of thing. DGO, I think that's Don Joy Orthopedics. I was looking at a video downstairs, maybe it was upstairs, about an artificial hip and an artificial shoulder. And I'm very interested because on November 29th, I replaced both my knees with artificial knees. I think probably Stryker, the guy who runs Stryker, is a good friend and is on the GenPro board. And I know where he lives in case they fail. Whether I'll be able to walk to his house is something else again. Covidien, again, same sort of thing, devices. Gambro, we know fairly well, they're in the bloods and fractionation. The accomplishments. 700 biotech companies in San Diego County, 100 in Baja. More than 40 biomedical device firms with 27,000 employees in Tijuana. In 2007, Southern California, 1.8 billion, which is more than half of the rest of the country got, which is pretty good. Mexico was the first developing country to patent biotechnology innovations. That's extremely important. Patents. Has to be vital. You're going to spend all this time, you have this technology, you have to rely on strong patents, or a much bigger company can come in and, as they say in the trade, eat your lunch. Take your products, sell it better than you can because they've got a huge sales force, manufacture it cheaper than you because they've already got the factories. So patents is extremely important, and in certain countries of the world, it's a big barrier to innovation. If you're going to spend all that time and money and come up with something, you have to own it for a period of time so long as you're willing to disclose what it is that you have and how you made it. Again, a lot of companies decide to be proprietary. Don't file for patents. Don't tell anybody, you know, and that's not going to help technology go forward, because the idea of a patent, you tell us what you've done, we'll give you an exclusive for a period of time in order that we can build on that and advance technology. And the annual economic impact of biotechnology in the San Diego region, direct and indirect, is about $8.5 billion per year, which is quite impressive. Let me tell you a little bit about GenProbe. I'm going to try not to get carried away. There's a big clock here that says I've got 11 minutes and 2 seconds. And I'll try to stay to that so that we can do a Q&A, which is really why I came here, to be able to interact with you, to hear your questions and try to provide some answers. So hopefully an alarm will go off when I hit 10 minutes. In vitro diagnostics. In vitro, literally, for people who study Latin, means in glass. And it's the opposite of in vivo, which means in a living organism. In vitro diagnostics takes a specimen out of a human body and analyzes it in the lab. Great example is a urine test. Actually, urine is the specimen that we use for our prostate cancer diagnostics. Easy to get to and easy to store. In vivo is more or less when you're having an MRI. If you have it, they'll inject some contrast media that goes inside the body, and they take a picture of where it goes. So here we'll talk about in vitro, those diagnostic tests that are based on taking a specimen out of the body and analyzing it in a lab. Interestingly enough, diagnostics didn't play much of a role in the health reform area, and it should have, for 2 reasons. One, diagnostics account for less than 5% of hospital costs and less than 1.6% of Medicare costs, yet influence 60 to 70% of all the decisions made on healthcare. And the mantra of diagnostics, earlier detection, earlier intervention, better outcomes, both personal outcomes and economic outcomes. And they're very inexpensive. If you find cancer early enough, while it's still contained at one site, normally you can surgically remove it. If you find it after it's metastasized, after it's led or fled from its point of origin to the rest of the body, got a real problem for the individual, plus it's extremely expensive to treat. So many things, find out early and act early, and you have much better outcomes. Now, IVD, when I joined GenProbe in 1994, nobody was interested in IVDs, in diagnostics. They were all interested in drugs. The margins for drug companies are much better. After they manufactured a drug and paid for all that, they still have 80% of the sales value left. Very profitable. Diagnostics, not so profitable. Fortunately, what we've been able to show is that if you do it right, and if you have products with tremendous clinical utility, you can charge a high price because it's justified. It's the value of the product. And GenProbe has done very well. GenProbe also has about a 70% gross profit and returns ordinarily 18 to 20% of sales after tax, which is pretty spectacular and as good as all the good pharmaceutical companies. So the fact that GenProbe has done well and the stock price has done pretty well, a lot of other companies have moved into the diagnostics arena, and that's a good thing for the reasons stated above. A lot of this I can go through pretty quickly. GenProbe was